What happens when COPD and asthma symptoms overlap? Imagine trying to breathe through a straw while someone is squeezing your chest. That's what it can feel like when symptoms of chronic obstructive pulmonary disease and asthma come together. These two conditions can sometimes blend into a situation called asthma chronic obstructive pulmonary disease overlap syndrome, or ACOS. It's not just having both diseases separately. It's a unique mix where features of each are present at the same time. Usually, adults over 40 experience this, especially if they have a history of smoking or exposure to harmful substances. About 27% of people with chronic obstructive pulmonary disease also have asthma, making this overlap quite common. When symptoms overlap, it can be tricky because patients often experience a mix of shortness of breath, chest tightness, coughing, wheezing, and sputum production. The severity tends to be higher, and symptoms last longer than with either disease alone. These patients often face more frequent flare-ups, called exacerbations, which can happen up to 3 times more often than in those with only chronic obstructive pulmonary disease. These episodes are often triggered by infections and can speed up the loss of lung function. The underlying causes involve both types of inflammation. Asthma usually involves type 2 inflammation, while chronic obstructive pulmonary disease involves type 1. This dual inflammation makes the disease more complex. Diagnosing ACOS can be challenging because lung function tests show mixed results. In asthma, airflow obstruction is often reversible, but in chronic obstructive pulmonary disease, it is usually only partially reversible or not at all. In ACOS, the reversibility varies, which can make diagnosis tricky. Treatment generally follows asthma management guidelines because the reversible part of the airway narrowing responds better to asthma medications. However, since the chronic obstructive pulmonary disease component is still there, ongoing management is necessary. Patients with this overlap often have additional health risks, especially if they smoke, like a higher chance of cardiovascular disease. Managing ACOS requires a comprehensive approach that addresses both respiratory and heart health. Overall, when symptoms of chronic obstructive pulmonary disease and asthma overlap, it creates a more serious health challenge. It leads to more symptoms, more frequent flare-ups, and faster decline in lung function. Recognizing and understanding this overlap helps ensure proper diagnosis and more effective treatment, so patients can breathe easier and stay healthier longer.